Hello, my name is David Pearson. I'm the director of the Hernia Center at the Mayo Clinic in Arizona. I'm here to talk with you today about hernias and some of the issues related to hernia repairs and the treatment of hernias. I'd like to go over some of the most commonly asked questions that I get related to hernias. The first question that most people ask me when I meet with them in my office is, what is a hernia? A hernia, simply put, is a break in the muscle and tendon, usually in the abdominal wall. When people develop a hernia of the abdominal wall, they will very often have bulging occur in that location. What this is organs on the inside of their abdomen that basically pop through the weak spot in the abdominal wall muscles. This can really happen anywhere, but we do see it very commonly in the belly button and in the groins. Hernias happen for a variety of reasons. Very often these happen when a weak spot in the abdominal wall slowly gets larger over time. This may be a spot that you were born with that slowly got weaker and thinner over time until it actually opens up. This allows for a weakness or bulging in the abdominal wall. Fortunately, hernias most of the time don't result in very serious or life-threatening complications. There are some circumstances, however, where people can have very serious complications from hernia. Most of the time, hernias cause other symptoms, pain, bulging, progressive enlargement of the hernia over time. And these often prompt people to meet with surgeons and talk about potentially getting them fixed. There are many different ways that we treat hernias. Some people choose to have their hernias fixed with surgeries, and some people choose to keep an eye on their hernia and not have surgery. There are advantages and disadvantages of both of these approaches. But for most patients, fixing their hernia can be a great way to repair their abdominal wall and get back to normal activities without the pain, discomfort, and bulging that the hernia results in. Unfortunately, hernias will not go away spontaneously. If you don't have surgery to fix them, they will stay indefinitely. Chances are over time, they will continue to increase in size. In order to fix the hernias, usually an operation is needed. Patients will often ask me, what are the risks of hernia surgery? Well, these risks are very similar to other surgeries that we do in the abdomen. There are often risks of bleeding, infection. With hernias, there's also a chance that hernias can come back over time. So it's very important that you talk to your surgeon about each one of these risks in the context of your other medical problems that you have. We are very fortunate at the Mayo Clinic in Arizona to have a multidisciplinary team of general surgeons who specialize in hernia repair, plastic surgeons, of physiatrists and pain management specialists and physical therapists who all work together to take care of the hernia patients. The Mayo Clinic name has become synonymous with collaboration in patient care. We are happy to provide this service to our patients, whether it is a small hernia at the belly button or a large abdominal wall reconstruction that's needed. We work together as a team of experts, and we have at our disposition every available expertise, tool, and technology that exists in order to help our patients have the best possible outcome, return to normal activity, and really have the best experience possible with their hernia surgery. These tools and experience and expertise, they really make us unique and make us stand out in the industry in fixing hernias. One example of this is our ability to perform minimally invasive hernia repairs. Many operations for hernias in the past were done with large incisions, which were painful. They had a lot of potential complications. Nowadays, we can perform a lot of these operations through very small incisions. This allows people to recover quickly, get back to normal activity quickly. It reduces their risk of complications from surgery and results in a much better patient experience. Minimally invasive repairs of hernias have really improved a lot over the last several years. One of the major advancements that we have accomplished is developing techniques to repair the abdominal wall and hernias of the abdominal wall using robotic instruments. These are small instruments that the surgeon controls in order to fix hernias. They allow us to replicate abdominal wall surgeries that historically we would need big incisions to perform, but now we can perform these same procedures through very small incisions. Our patients have had excellent results with these types of hernia repairs. They've had minimal pain and they've been able to return to normal activity very quickly. We're very pleased to offer these options because our patients have had excellent outcomes with them. Our number one goal at the Mayo Clinic is caring for our patients, protecting them, and keeping them safe. In the current COVID-19 public health pandemic, we have had new challenges in working with patients and making sure that everyone is taken care of safely. In order to accommodate this, nowadays we are doing many of our consultations with patients over the internet, over the telephone, virtually. This allows us to meet with patients, discuss the problems that they have, and come up with treatment plans and treatment options, and even plan for surgery without ever bringing the patients into the office physically. If you have or suspect that you may have a hernia, we would love to sit down and talk with you about what options may be to fix your hernia.